Last part of this chapter, we are going to talk about infection control. Same learning objectives. So, for PTAs, our critical responsibilities are hand hygiene. You never heard that, right? Use of appropriate PPE, environmental cleaning, patient education, recognizing the signs of infection, following isolation precautions when necessary, staying current with vaccinations. So we can play a vital role in breaking the chain of infection, particularly with hand hygiene and environmental cleaning and appropriate PPE. So just remember, you could break that chain. You always want to perform hand hygiene before and after patient contact, before putting on gloves, after removing gloves, after contact with potentially contaminated surfaces, before you eat, and after using the restroom. So you can use alcohol-based hand sanitizer. That's easy. You can carry it with you. It's all over the place. Soap and water when your hands are visibly soiled or with C. diff infections. You definitely want to use soap and water because alcohol-based hand sanitizer doesn't kill it. The Sometimes, especially working at the hospital, I feel like if I'm hand sanitizing too much, my hands start to feel like there's a film on them, and then I will wash my hands with soap and water. So I like soap and water, but alcohol-based hand sanitizer is great. And the first job I ever had at a hospital, I worked in a chemistry lab, and I always remember the guy who trained me. He said, "This is one job where you want to wash your hands before you go to the bathroom as well as after." I'm like, okay. So, hand hygiene important all the time. Do it. High risk situations, patients with open wounds, and that includes surgical wounds. People with respiratory infections because you can just spread that stuff around. Anybody with GI symptoms, anybody who's immunocompromised, or if you know someone is known to be infected with antibiotic resistant organisms, they have a positive diagnosis for MRSA or one of the antibiotic resistant organisms. Equipment concerns are big. Shared therapy equipment. Early on in my PTA career, I did some travel assignments, and one time I was at a facility. There was a big norovirus outbreak in the North Seattle suburbs, sort of, and other places. And I was doing a travel assignment in a skilled nursing facility, and we were not allowed to bring patients to the gym because there was too much. Patients weren't allowed to eat in the dining room. They had to eat in their rooms, and we had to do treatment in the rooms because there was too much transmission of norovirus. I got it. It was fun. The good thing about norovirus is you're horrible for 2 days and then you feel better. But we had to wipe down all the equipment and all the rooms and everything with 10% bleach solution at the time. So that shared therapy equipment and exercise mats and tables and exercise equipment, it's really important to clean that stuff. The gait belts now, you in the hospital, a lot of times they'll just give or not give, but they'll give a patient a gait belt and they keep it, they go home with it and their own assistive devices. We don't share gait belts the way we used to. And then they have plastic ones that are more easily disinfected than the cloth ones. So that's just for infection control. In the gym areas or the pool and aquatic therapy areas or group treatment areas, you want to make sure that everything gets wiped down all the time um, after each use. So you need to recognize signs of infection in yourself or in your patients. Systemic signs include fever, malaise and fatigue, changes in mental status. That's particularly true for elderly people. Decreased appetite. Local signs include redness, warmth, swelling, additional pain or tenderness, drainage or discharge, or an unusual odor. When if you have any concerns about changes in patient status, alert nursing if you're in a facility, an inpatient facility, or the physician. If you're in an outpatient facility, you want to alert the supervising PT and the physician as soon as possible, especially post-surgically. That's pretty important. Special populations, pediatric patients, elderly patients, and immunocompromised patients. There are obviously different reasons for each one of those, but we need to make sure we're really being vigilant about infection control. It's important to document the patient's infection status if they have an active infection, the precautions that you followed, any exposure incidents, and any changes in patient condition. And you want to communicate concerns with your team immediately, follow your facility protocols, and be up to date on infection control meetings and policies that change. When you work in a big facility, particularly, policies are always changing, and so you've got to keep up to date on them. Emerging infections and antibiotic resistance, current concerns, resistant bacteria, C. diff infections, Candida auris is a current concern. COVID variants and other new viruses that might be lurking out there, avian flu. Um, if it's important as healthcare professionals that we stay informed about current threats and follow evolving guidelines because the guidelines are always changing. Participate in education for your facility and advocate for appropriate precautions. If you don't have the proper PPE provided by your employer, ask about it. So it's our professional responsibility, our duty to protect patients, and we are obligated to follow standards of care and report. And we need to know what the reporting requirements are for exposures. So you really that's a professional responsibility, and you need to take that seriously. Personally, you have the right to work in a safe environment, and you have a responsibility for your own health, including vaccination requirements. For the patients, you need to keep privacy regarding infection status. You can't say like, in the crowded gym, that person's infected with MRSA. You can't. And the person, but everybody they have and everybody else in the gym has the right to safe care. So you need to get informed consent for procedures, and we'll talk way more about that in other classes. But everybody has the right to safe care. So if we maintain infection control standards, we're promoting that. So the key takeaways are the chain of infection, because that helps understand how you're going to prevent things. There are multiple ways to break the chain of infection. Be familiar with common pathogens, bacteria, viruses, fungi, and parasites. Each have their unique characteristics and unique ways of dealing with them. Special attention for high-risk populations. Hand hygiene is the single most important infection control measure. You should embrace it. Embrace it like it's your best friend. It's your professional responsibility to contribute to infection control efforts and to stay current with evolving guidelines and threats. So, continuous learning is every professional's responsibility and joy. And those are our responsibilities as PTAs. So these are just some questions to think about. How would you modify your treatment approach for a patient with MRSA? Okay. What education would you provide to a patient with a history of C. diff infection? Like, what can they do to keep from getting it again? How do you balance infection control with providing effective physical therapy? That's been a big focus for the last several years, but even before that. What do you do if you suspect a patient has an undiagnosed infection? And how has COVID-19 changed infection control practices in physical therapy? The funny thing is I always tell people I grew up with my dad was a school teacher, and he taught at different levels, high school and other levels. And he was a germaphobe. Before the word was ever invented, he was an OG germaphobe. And so he was always disinfecting stuff and hand washing, and he used to, before, in the day before antibacterial, hand sanitizer and that sort of thing, and antibacterial soaps. He used to Lysol his classroom between classes, and the other teachers would tease him. And so I grew up with that as normal. And so before COVID, in the clinic where I worked, myself and one other therapist, we were always sanitizing everything and cleaning everything and, whatever. And then after COVID, everybody was doing it. So that's how it changed for me, is that everybody joined in my thing. But um and I always I watch my distance. I've always done this my whole life. I watch my distance to people. I don't like to stand right up close to people. Um, I if I have to sign something, I bring my own pen. So I'm not touching, whatever. And so it just like that heightened awareness has really changed for everybody in physical therapy, but for those of us who are like naturally nutty about stuff like that, it really hasn't changed all that much. We're just glad that everybody else is doing it. So additional resources, the APTA has different sections, and the acute care section has a lot of infection control resources available. State practice acts have requirements for infection control, and you should know about those. We'll talk more about that as well. Within a facility, most larger facilities have infection control teams and policies, employee health programs, and continuing education opportunities. Usually, those are required continuing education opportunities. The CDC guidelines are very specific on healthcare associated infections and antibiotic resistance and vaccination recommendations. So you should definitely keep in touch with all those different resources. So thank you for your attention. And remember, infection control is everybody's responsibility, and PTAs play a crucial role in protecting patients, colleagues, and themselves. So stay vigilant, stay educated, and stay safe from those bad little microorganisms. If you have any questions, come to office hours and bring them up.